Welcome to familydoctor.expert. Today I'm talking about chlamydia. Now, chlamydia is the most common bacterial sexually transmitted infection in the community. Probably every once a week or once every second week I see a patient who's contracted chlamydia. Now, it's passed on from one person to another by unprotected sex. By unprotected I mean no condoms. And it's often called the silent infection because often people don't have symptoms, so it's very easy to catch. So your partner might seem totally healthy, but you can still catch it. The reason we want to detect it is it's very easy to treat, and if we don't treat it, it can over time cause infertility or prevent you from being able to have babies, and also cause an infection called pelvic inflammatory disease. So it can get into the female system and scar up the tubes, and this is a real tragedy and something that we can avoid. In Australia we've seen a huge jump of cases and around the world, and in particular it seems to be a really high jump in cases in young people between 15 years of age and about 29 years of age, so particularly focus on them. But anyone can get it. Any male or female or men who have sex with men can contract it. So as I said, it's often no symptoms, so people don't know they've got it, but about 50% of the time men have no symptoms, and 80% of the time women don't have any symptoms. So it just sits there damaging the organs, and when they do have symptoms, men come in often with pain or urination. Sometimes they get swelling or pain in the testicles. They might notice a discharge, they might notice some redness at the end of the penis. Women sometimes notice a discharge. They might notice they're getting a bit of bleeding between periods, or notice a bit of bleeding after sex. Sometimes they've got lower abdominal pain, and rarely they can have discharge from the anus. And in fact, chlamydia can cause an eye infection in rare cases as well. So I highly recommend that you get tested with your GP. You don't have to have a physical examination if you don't want to. Even sending off a urine test just takes 2 seconds. Send off a urine specimen, and we've got some pretty clever technology that can detect chlamydia with quite a high degree of sensitivity. There's also a possibility to detect chlamydia using the usual swabs of the vagina or the penis or the anus, and your doctor might want to do that. Treatment is simple. Often it's just a single dose of antibiotics. There's 2 in particular we use, azithromycin and doxycycline, and they're both effective. Now, one of the sensitive things is you need to inform your partners, and you should at least tell partners that you've been with over the last 6 months, but pretty much you could have had it for quite a while. Now, this can be a pretty awkward conversation, and you should know that there's a good website called Let Them Know by the Melbourne Sexual Health Centre. And this gives you even the option, if you can't really face some of your previous partners, to get them sent an anonymous letter or SMS or email. So that's worth keeping in mind, but you want to make sure people know so that they're not spreading the infection. Once you've had the antibiotics, symptoms go away in a few days, and then preventing it in the future, condoms or dams will prevent the infection and other sexually transmitted diseases as well. I recommend for all my patients under 25 years of age that they have an annual chlamydia checkup. It's easy. If they pop in, just say, do me a urine test. Or if they're having a pap smear, we can easily add a swab for chlamydia. So the only other thing I'd say is, if I do detect chlamydia, I tend to do a full sexually transmitted diseases checkup. So that will usually be a blood test looking for things like hepatitis and HIV and syphilis, and a bunch of swabs to make sure there's no other infections such as gonorrhea or other things. So the message is to try and prevent STIs by using condoms, and have a checkup with your GP. Anyway, that's all from familydoctor.expert.